Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, retinitis pigmentosa. So this retinitis pigmentosa is actually a photoreceptor dystrophy. It is a photoreceptor dystrophy where there is damage to the rods is predominant. It can be either sporadic. It can be this retinitis pigmentosa can be sporadic, or it can be autosomal dominant, or it can be X-linked recessive. Sporadic is actually the most common form, and autosomal dominant is the most common form of inheritance. Sporadic is the most common form, but if it is inherited retinitis pigmentosa, then autosomal dominant is the most common inherited form and it has the best prognosis, whereas X-linked recessive form has the worst prognosis and it is the least common type of retinitis pigmentosa.
thank you and thank you for watching.